tent that is broad enough and deep enough that we can address this problem. That's what today is all about. So Kari, come on down. The price is right. And I want to also recognize Ari Bernstein, who is also an MD, PhD. He is actually co-director of Sea Change at Harvard. And I'm so excited that he's here. He is a pediatric hospitalist at Boston Children's Hospital. He focuses on pediatric environmental health and the uniqueness of kids and their vulnerability to climate change. And his mother's in the audience, and she should be enormously proud of her son. And we've got, come on, Nadine Burke-Harris. She's an MD, MPH, FAAP founder and chief executive officer of the Center for Youth Wellness, which focuses on chronic stress in kids who have been displaced due to climate change and extreme weather conditions. So we are ready to rock and roll. Did I do something?
Oh, no, we're just gonna, we have to.
Oh, there we are. No, we're not. There we are. No, we're not. Oh, there we are. So thanks, everybody, for watching online, and thanks, everybody, and congratulations to the panel. So, Ari, why don't you kick it off since Kari got a chance to speak first on, so tell me, how is children's health impacted by climate change? I know I've been yapping about it, but you give the details.
Thanks, Gina. So I think it's really important that people get that climate change, if it's been seen as a health issue, is most often seen as, you know, sea levels are going to rise and that's going to lead to flooding, or air quality might get worse. But I think it's critically important that we really get to brass tacks as much as we can about, you know, what is at stake for the health of the kids that I have to take care of at Boston Children's, that, you know, we've got a host of pediatricians that are taking care of kids in various places. And you know, if you look at the things that the parents that come to see me are most concerned about for their kids, I mean, we have several epidemics affecting our children right now. We have epidemics of allergy and asthma. We have epidemics of obesity. We have epidemics of mental health problems among our children in this country. And if I were going to write a prescription for us to tackle those, I would write a prescription to fix climate change. And here's why. Because if you look at the causes of those problems, they overlap enormously with what we're seeing in the illnesses in these kids. So the air pollutants, the threats to their security. I mean, you know, we're in California. It's hard not to think about wildfires, but anyone here who's lived through a house burning down or knows someone who's had their house burned down, these are events that stick with kids for their lifetime and change their dispositions, and you'll hear more from Nadine, who will talk much more eloquently than I ever could about these things. And so it's just this enormous opportunity for us to really get at what's troubling our kids right now. And in some ways, I just see it as an opportunity in that regard.
Ari, can you talk about the vulnerability of kids to exposure to pollution and why they're unique?
Yeah. So you know, well before I started training, I hope, the idea was that kids were little adults, and that whatever mattered to an adult mattered to a kid. And you know, doctors are supposed to be smart people, but that's really stupid. You know, kids are.
What'd you say?
For the record. So you know, first of all, you know, there's this unique period where children are in utero when they're exposed to things that their mothers might be exposed to, which is unique. And their organs are all still growing up and developing. And because of that, they have peculiar, you know, vulnerabilities to pollution, be it air pollution, metal pollution, mercury and lead. All of these things affect developing brains, developing lungs, developing hearts in ways that are much more significant. And I think it's worth adding that not only are these you know, vulnerabilities more pronounced in childhood, they stay with people throughout their lifespans. And the more we learn about, the more we're able to track kids over life, we understand that these early childhood pollutant exposures can manifest in diseases much later in life. So the gains are yet even more pronounced. Preterm birth is another thing that we're increasingly understanding is related to air pollution. Preterm birth has lifetime health effects. So I think that, you know, children are uniquely vulnerable because they're developing organ systems. Anyone who's had a toddler knows they like to pick things up that other people might not and put them in places other people might not, and so forth and so on. So I think that we have to really be looking out for them when it comes to these issues.
And that includes fetal exposure, right?
Yeah, absolutely. And you'll be hearing from some people who spent their entire careers thinking about these issues in a little bit. But it's sort of shocking to think about how even before a child comes into this world, a substantial proportion of their health for their lifetime is determined. And pediatricians were the people, for example, who were, if not directly recommending, certainly endorsing, not breastfeeding children for a long time. So we're coming around, we're getting more intelligent, but we recognize that we really do need to think critically about, what we are exposing not just children to, but women who even may become pregnant, and certainly women who are pregnant. And a lot of those things have to do with things that directly relate to the causes of climate change. The burning of fossil fuels. Many of you know that, for example, the increased use of natural gas in this country, which is replacing coal, a large part is it for energy, but a large part of it is used to make chemicals and plastics. And so, we think about the chemicals that are involved there, and you think about exposures that children and women might have. It's all a part of this issue of our reliance on fossil fuels. So if we tackle climate change, we will in fact tackle some potentially huge health issues we face with our kids right now.
So this is what you call turning science into action, and also making sure that whatever action we take on climate provides an opportunity for us to really improve kids' health. It's amazing what science tells us these days. Nadine, you're in an area of research and work that I'm probably least familiar with, which puts you very low because I'm not that familiar with any of it. But no, I actually pay quite a bit of attention. But you have done some remarkable work to look at how we understand and prevent harms that come along with issues of trauma. Now, I don't think most people really think very much about this until it happens to your family, until you see how your kids are impacted. And clearly, climate is an issue where extreme weather events and other things can cause significant trauma. I don't need to say that today. I don't think if anybody's watching the news, they're seeing a hurricane that's twice the size of 2 states bearing down and people having to evacuate. Nadine, give us a sense of some of the research that you've had and how you see that relating to some of the issues or concerns that are here and coming up.
Well, Gina, you're not alone, because there are the fields of adverse childhood experiences and toxic stress are really emerging, and has come out of research that has really emerged in the past 2 decades. And it's this understanding that when kids are exposed to stressful or traumatic events, especially when they're quite young, this data that came out of Kaiser and the Centers for Disease Control demonstrates that they have a dramatically increased risk for long-term health problems, including heart disease, chronic lung disease, cancer, Alzheimer's, et cetera. And we now understand that the mechanism is this biological process that we now understand to be called toxic stress, in which overactivity of the stress response leads to changes in kids developing brains, they're developing hormonal systems, their immune systems, and even the way their DNA is read and transcribed. And one of the things that's incredibly powerful, there's this really strong connection between the way a child's developing body, right, this responds to the effects of air pollution, for example, and their histories of adversity. So what we find is that the impact of climate change isn't an equal opportunity killer. Right? It's a dramatically increased risk for those in vulnerable communities and those in vulnerable populations. And just as an example, when they looked at research studies to look at lung function in kids who were exposed to the same parts per billion of air pollution, the kids who had experienced higher adversity had worse measures of their lung function than the kids who had experienced very little adversity. So what we understand is that for our vulnerable communities, there's a double whammy, right? It's not only the fact that they've experienced this adversity, but then on top of that, the impact of climate change on our vulnerable communities is even worse.
Can I ask a silly thing? Raise your hand if you've ever heard anything like this before. You're way smarter than I am, but the vast majority of you have not. I think it's remarkable. You know, I thought about this a little bit in the work that we had to do in Flint, Michigan, which is a clear example of a community who is impacted severely by poverty. And one of the things that I learned then was the relationship between lead exposure, which is what we were dealing with there, and good nutrition, and how nutrition can mitigate some of these outcomes of exposure. But this is a more central issue. This is one where your actual genetic makeup is changed as a result of trauma. And it's just remarkable, and you wonder what will happen in a changing climate where these big weather events get so much more routine, and where, to me, the world will be so much more out of your control. It will feel like you don't have control of your own destiny, which is probably how many vulnerable communities feel today, right?
And that's exactly why climate change is a double whammy on our vulnerable populations, because, for example, with climate change, we see not only increased air pollution, et cetera, but we also see increased risk for things like fires, right? Which are frankly, in and of themselves, right, for anyone in Northern California, a traumatic event, right? And so you're not only having an outsized effect on vulnerable communities, but you're also increasing the frequency of traumatic events, which then makes children more vulnerable to having poor outcomes.
I was just looking at a map the other day of the air emissions, the air pollution emissions from the fires out west. They literally stretched in the middle and down to the east 1,000 miles. It made a 1,000-mile swath of the United States have higher levels of air pollution than is appropriate for health. It's just amazing. And I'll never forget that little conversation of that young boy with his grandfather. Did you see it?
I didn't see it.
They were caught in the fire, and he called his grandfather and asked him if he could come and get him out, and he died right after that conversation. It was like, oh man, how do we deal with this? That's what runaway climate change is, not what we can allow to have happen. All right, do we have a happier note? I'm not sure there is one right now, but other than the fact that we have solutions and we can take action. Kari, you know, one of the first times we met is we talked a lot in the Los Angeles airport is where we first met. We hung out at a table, and I realized that she has 5 children and is one of the most remarkable human beings in terms of the work that she does with children on allergies and asthma. Kari, can you give them a sense of why this is an issue that you're now going to spend your time on, if you can possibly have any? It's terrific. So if you could just give them a sense of what you're seeing, specifically in the work that you do with kids in allergy and asthma.
Yeah, thank you, Gina. This is such a critical issue right now, and we're at a flexion point, and I want to make sure that everyone here in the audience knows that these solutions are tangibly in our grasp. And so we need to act on them now, individually, communities. And when I see communities get together around this and really dispose of any political spheres and have their interests coincide to make sure that their kids' health comes in front of any other interest out there, I see change as possible. And so let me give you an example. I feel very privileged and humbly very happy that I can take care of patients of all different ages with allergy and asthma. But unfortunately, over the past 20 years that I've been here, I've seen this huge increase. And while I was in clinic, I saw a lot of people coming up from the Central Valley into my clinic at Stanford, which takes a long time to get to. And I was doing tests in their blood and looking at blood over time, as well as how it might be associated with asthma and allergies. And we were looking at pollution, but the thing that bothered me the most is that the children from the Central Valley had the worst changes in their DNA, and that DNA could be passed on to their children. You're going to hear more about that today in our second panel, but it's exactly like Dr. Harris was mentioning. It is in our genes now. These pollution events are traveling forward, and we have the capacity to now change that. The community around Fresno heard about this research. They're in the Central Valley. This was happening to their children. They got together with their city council members, looked at our science, helped that science move forward, changed the diesel exhaust emissions in their school buses, and we were able to show that the reduction in asthma was about 30 to 50% after changing the diesel exhaust emissions in the buses just after 6 months. And then I was able to show that in their DNA, it was reversed. And so this change is palpable. I'm excited about working in global climate change and very compelled, just like you are, to make sure we leave this planet a better place. And we leave our kids' health potential a better potential than where we left it. But I see that these actions are very doable on the community, on the individual level, and I'm excited about being here today and seeing all of you being interested in this. But we need an action plan, and it's possible with certain examples that we have out there already, but we're going to get there.
Kari, I think one of the things that I'm interested in is how do we get this information out? And you know, I think Fresno is one of those communities. It's filled with migrant farm workers. I spent a little bit of time there because they didn't have water, clean water. I mean, it is a fundamental problem. And frankly, until I worked at EPA, I never would have guessed that people in the United States, whole communities had no water. I went to their grammar school, and they have to bring bottled water with them to the school. It just doesn't exist. And I think we took some steps that are, are designed to correct those problems. But how do we get people engaged? You know, is there anybody from a mom's group here? Which one?
Mom's Clean Air Force.
Mom's Clean Air Force. You know, one of the reasons why we focus, I think, on kids is not because they're the most vulnerable and it's a lifetime of damage, but because moms care about this stuff. How do we get the word out, Kari? Do you talk about this when you see patients?
Absolutely. I think we can all be instruments of change, but I think we all act as a community to echo and support each other. And I also think that beyond politics, people are going to focus on something that individually affects their lives and future lives. And with that, for example, in the community, we have conversations and dialogues all the time. We want to do focus groups. We want to understand, what are your needs? What are you worried about? And it echoes for moms and dads alike. They're worried about their kids. They want to make sure that they live healthy lives. And so they then become instruments of change. But we need to make sure we get the information out and the correct information out, make sure that people are understanding what we're talking about. I think what we've done a lot is to work with the local high schools, work with the kids themselves, get them involved right away in understanding how are their lives affecting, and the fact that this is not undoable, that we have the potential to make sure we have cleaner air, to make sure we have cleaner water. But these are going to become more severe in their problems that, like Gina was mentioning, the aquifer is getting drained out of the Central Valley. It's not what we used to be dealing with. How do we go? We can't go back to a situation that might not necessarily be the same that we're trying to go towards. We have to understand that looking at what the kids are suffering from, getting communities engaged in different ways that the media can work with them, blog posts, Facebook, interacting in conversations, not just through the internet, one-to-one conversations with people. And I think that's how hopefully eventually we get the right science out there. But we need to also find out from the communities, what are their needs, what resonates with them, and then move forward within that.
Do you see people understanding this as a climate issue?
Yeah, I think that at least from what I can see in the Fresno community in the Central Valley, that people are seeing that the global climate change is a reality. that people that are living in the Central Valley, but not just Central Valley, I think people in the Midwest, we're having to deal a lot with the wildfires. People are seeing, for example, in many parts of California, as well as other parts of the United States, rates of allergy are up 70% of the population. So 7 out of 10 individuals have a verifiable allergy. 20% might have asthma. Increases in allergy are through the roof. Food allergies doubling every 10 years. So this is beyond just genetics. And so I see this as a conversation by which we can move forward on global climate because of global climate change, we're seeing the pollen season increase. We're seeing pollens being emitted in the air 1,000-fold than where they used to be. And then in addition to that, not only are we seeing issues with the pollen changes and asthma and what we breathe in, but if you just think of the relative levels of pollution, and if you have a wildfire, that's going to increase it by 12 to 15-fold. So we're talking about 100 parts per million, let's say in LA. You get a wildfire nearby, that goes up to 1,200 parts per million. And then there's no safe place where you can't be affected by this global climate change. So yes, the people are feeling it, and I think they're feeling it because of these extreme weather conditions.
Well, one of the things that I learned at EPA is when you look at health consequences of rules and regulations that you put into place, you really want to look at identifying those health consequences and highlighting the ones that activate people to want to support things that are health beneficial. And what I found was something that I really didn't anticipate. I realized, because I like to communicate this stuff, and you're watching people's faces, but if you say premature deaths, it's a blank face. If you say asthma attack, people sit up and say, what? Seriously, and I think some of the biggest challenges that we're facing, we simply don't articulate well. And they matter a lot. I don't think there's a mother in the world that wouldn't trade a shorter life for themselves to get asthma out of their kids' lives.
Yep.
Do you know what I mean?
Absolutely.
And we just, I'm sorry, and I don't mean to diss fathers, they're awesome too. I just don't know any fathers groups that are engaged. Hey, Ari, that's a new venture for you. This would be great.
Exactly.
But I do think communication is important. And we talk about the spread of vector disease and the spread of allergens as if and the discussion ends there.
It
It's
doesn't
the
have
start.
to. Exactly. It's the start to compel us to change. Look at LA, 1960s. There was no day that met the standards for the EPA. No day. People were, increasing their asthma. People felt like they were breathing in substances that were burning them, just like when we breathe in the wildfires around here. You can feel it right away. It's palpable. And so because of that, people changed. They changed emission standards. And now we have LA that there's 50% decrease in risk of health issues compared to the 1960s because of changes that occurred at the local level that were stimulated by people that were dealing with this, by doctors that dealt with these asthma risks. So I think there is definitely examples of change that can happen and that we can actually see the differences already.
Yeah. Ari, can I come back to you and just ask you, because I know you've thought about this and do some work in this area. How do we get physicians to be advocates for change that's broader than delivering the right medication or healthcare services?
Yeah.
How do we get them to be the communicators to us with their patients and the patients' parents, to let them know that there's other ways in which they can make their kids healthy than simply taking them for health care?
Yeah, I often tell residents I work with that, we're very good as doctors when a kid comes in with an asthma attack to give them another medication. So, the routine is if a kid gets hospitalized with asthma, they probably got severe asthma, what do? We give them another medication. And they come in another time, we give them another medication. And what we don't tell our residents to do is to simply ask, where do you live and what kind of things might you be exposed to and how we might, in fact, do some of that. And residents are often shocked because, frankly, right now in medical schools, there's almost zero education about this. So it has.
Did you say almost zero? Were you being more gracious than you should?
No, it's almost zero. Almost zero is probably fair. So it has to be, and this is a key point here, is that when we talk about health effects of climate change as population level effects, it's going to increase rates of asthma. It's going to affect allergy rates. Doctors need to know how it's going to affect their ability to do their job. So if you tell a doctor that, oh, by the way, you're working in an emergency room and your ER is going to be overcrowded after a heat wave, and that we know that overcrowding worsens care for everyone in that ER, then all of a sudden it matters to them. If you tell a doctor that if there's a storm that's coming, and that the problem is not going to be providing care for the people in your hospital, although it could be, it's going to be getting patients who you cannot care for out, or people who you need to get care for in, then they'll pay attention. If you tell a doctor that prescribing a patient a medicine that can affect their ability to sweat, to urinate, at the start of a summer, in a place where summers are like Boston, people are used to cold weather for a long time before it's summer, that could potentially affect that patient's risk of dying in the same way that a doctor given a patient who worked heavy machinery or required, did a job where being on an opiate could put them at risk. You would always tell that patient, be careful, you're being put on a medicine that can impair your judgment and your attention. If they understood that giving a patient a medicine that could affect the patient's ability to sweat and urinate as a heat wave was coming on, they're going to care. Doctors care already. There's lots of surveys showing that doctors are very concerned, that they see it as an issue for their patients right now, but they don't see how it matters to their professional existence. And that's a bridge we have to build, because if you look at who Americans trust, it's nurses first. And nurses, by the way, are way ahead of the doctors. The nurses get this probably because they're mostly women. I noticed that in this room there's a fair gender bias. But next to that, doctors are right up there.
Nurses can be men too.
Nurses can be men. That is absolutely true. And so, if we had physicians working in communities, as both Nadine and Kari alluded to, talking to people where they're at in conversations where it's not about the politics of the issue, it's not about what your moral values are, it's simply about what's best for the care of your child. It's a very different conversation.
Absolutely. Well, I can tell you that having worked in these issues and areas for a long time, that there isn't a Republican that doesn't want the best health care for their children, or the best community for them to live in, or the cleanest air, or the cleanest water. It is so far from being a partisan issue. I keep saying we've got to get climate change, out of partisanship and at your kitchen table, at your Main Street, and in Wall Street. When we succeed at doing that, we'll have a real opportunity. Nadine, I think yours is one of the biggest challenges, because it's difficult to understand how these sort of mechanisms work scientifically. And what do we do? What is the resource that parents would go to protect their kids, in these circumstances, to try to be helpful? I know that we can't take away all the trauma, but what do we do?
Well, there's a tremendous amount that parents can do. And in fact, our organization just launched a website called stresshealth.org to answer that very question, to help parents understand what it is that they can do. And one of the most important things that they can do is learn how to recognize the signs and symptoms, right? Yeah. And there's a tremendous amount of science around how stress can affect your brain development, your DNA, your immune system. But what we don't talk enough about is the science of our power of healing, right? How it is that having these nurturant relationships can reduce inflammation, can improve brain development, can actually affect our epigenetic regulation. And this is a place where
Can you explain what an epigenetic
that's right. But you know, epigenetic
Not that I
regulation.
don't know this totally, it's for all the others who may not.
So that refers to your so your genetic code, right? Is your genome, right? That's your DNA, and then above your DNA is something called epigenetic markers. And if you think about your DNA as musical notes, your epigenetic regulation is like musical notations. They tell your body how loudly or softly to play a certain segment of DNA. It actually programs the way that our body expresses DNA. And our epigenetic regulation is vastly influenced by our environment. It is influenced by things like pollution. It is influenced by things like stress and trauma. And this is a place where I think that parents and caregivers have the opportunity to come together with medical providers, both to understand how they can be a healing force for kids, and in addition, for us to understand how we can create change on a large scale. Because I believe, listen, I believe very strongly, to Ari's point, that doctors can be powerful advocates. We spend a lot of time in the clinic, so even more powerful what we've found in our center is when we combine the activism on the ground of passionately caring mothers and fathers and aunties and uncles and cousins and grandmas who are working day in, day out, and leverage that with the professional expertise, right, of someone like myself or Kari or Ari in not only shouting from the rooftops, but bringing also to bear the science and the rigor in terms of best practices, then we have an opportunity to see even more substantial change.
So how do we, on all these things that you're raising, and I know we're going to get into many of the details because of all the great researchers that are here who are going to be able to speak to these issues, but as a person like me who tries to communicate this stuff, but has for many years tried to establish policies to change this, and I know we're here to talk about climate, and I think it's important. What's the change trigger here? What do we do? I mean, in a case like that, I realize that the families will hunker down and help their kids, but how do we make that the standard thing to do? How do we make people understand that they have that power?
Well,
I'm demanding you tell. No, that's all right. I got overly excited.
So my immediate short answer is honestly raising national awareness and offering people digestible, bite-sized solutions that they can do in their home, right? And that is what we have tried to do with our Stress Health Initiative. But I think it's the same piece on climate change. Exactly what you talk about. When we talk about climate change, it's like, oh, the globe, it's the whole,
It's like, what can I do?
What can I do, right? But then when we talk about things like, and Kari's talking about solutions, the residents of Bayview Hunters Point, which is the neighborhood that I serve, got together. They had the highest asthma rate in the city, the highest asthma hospitalization rate in the city, and the recognition that it was a particularly vulnerable community, in addition to the fact that there were not one, but two oil-fired power plants in the neighborhood, and they got together. Yes, they got together, and the Bayview Hunter Point community advocates, Literacy for Environmental Justice, got together, and they shut down the Bayview power plant.
How cool is that?
Yeah.
And I happen to think that probably had an impact on CO2, which is also a nice measure of success, but not the primary one, not the most immediate one.
But the piece is that we have to recognize that we are powerful when it comes to any one of these public health crises, and particularly with climate change, this is not something that is beyond our capacity to solve. We are powerful and we can do it.
That's terrific. Kari, what do we do about allergies and allergens? Can you help me with that? I mean, I know I'm not sure that everybody is aware of how much that is exponentially increasing.
So how many of you are interested in that answer? So, you know, part of what I think you're all hearing is that we're creating a venue for good research. We're creating advocacy, and then we need to disseminate that knowledge and make sure that that type of knowledge, this is just an example of one where we now know what could be the cause of allergies increasing and asthma increasing. I mean, we are getting better at our knowledge thanks to a lot of great science. So with that, we've also, by looking at who's protected and who's not against pollution and stress, we're really following families long-term that live in areas of pollution or wildfires or water security issues. And why do some people develop high levels of allergies and asthma? Most of them are, and why do some not? What behaviors can we now learn from? So good diets, less stressful environments, good sleep, all of these things help protect you against some of the issues in health. In terms of allergies and asthma, getting low amounts of vitamin D, having a lot of stress in your life, being exposed to lots of tobacco smoke and pollution increases your rate of allergy and asthma. We know that to be true. I really worry about allergies and asthma because it's not just increasing in size, but it's also increasing in severity. Now, about 1 in every 3 minutes, someone's going to the emergency room due to an allergy or asthma event. That is way too much for a situation that we can prevent. And most of those issues around those health issues like allergy and asthma are because, of global climate change. Communities, and as Nadine was saying, we can make sure we educate, but also that we can ourselves make an impact, support nonprofit organizations that are doing work in this area, support local representatives that are your politicians that are helping change bills into laws that mitigate climate change. Also, vote with your mouse. You know, you are consumers. Consume those products that are greening the planet. Make sure that we choose the right things for our kids that are going to help them with their health. And then importantly, educate. Anytime that you get a chance to talk to others about global climate change, talk to them about what you've learned here. So individually, as a community, and then as a population. But I think that for me, allergies and asthma are what I live and breathe every day, literally and figuratively. But it's not the only health issue that we're going to be talking about. We hear about mental stress, developmental delay, cardiovascular issues. They're going to be increasing if we don't stop it now.
Thank you. Ari, one of the things that I want to make sure that people understand is that, you know, a lot of things can happen, and I think Nadine and Kari were clear about this, at the local level. So much opportunity exists at the local level with the right information. But I think there's also policies we can work at the city level. I mean, I certainly hope there is, because this whole conversation at the summit is about activating states and mayors, because in the United States, all the juice isn't held at the federal government level, that's for sure. And in my experience, all of the creativity is below, you know, and you build on that when you get to the federal level. What are some of the things that, you know, I know that we've been talking about? What do we do to build health into the solution set for mayors when they want to make change, or for state government? Where can we direct them so that you get both climate benefits, but also immediate health benefits?
That's a great question. I think it speaks to this conversation we're having about how do you make climate change personal and local and relevant. And I think I saw Dick Jackson here, who I'd like to acknowledge, because the reason I know anything about this is really from Dick, who was really one of the first people in the country to recognize that, you know, cities are constantly reinventing themselves, and for a long time we were reinventing them in ways that were completely absent of any consideration of health. I mean, in the most acute sense, you think about a hospital, and I hope none of you have ever been in a hospital, but if for any of you who have, it's sort of shocking to think that anyone could actually heal in these buildings. I mean, really, you know, no daylight, terrible food, bad air quality, lots of excess noise, bad lighting. And yet this is where people are supposed to get better. So too with the communities that were designed. These communities, no sidewalks. You know, there were protesters outside saying, save the bike lanes. I'm thinking, I bike all year in Boston, which is probably a sign of lunacy, but I do it anyway. In Boston, we should have signs, save the bicyclists, because, you know, it's just, you know, here you can bike all year. In Boston, it's sort of a blood sport. So, you know, if we're talking about what mayors can do and what they can get behind, you know, there's first of all science, and I'm thinking of a recent publication, and speaking to mental health, there are communities in the United States that have been left behind, where there's lots of abandoned buildings and lots. And this study was a randomized trial, looking at transforming these abandoned lots into green spaces in this community, and showed a profound effect on the mental health of those communities because you weren't walking by. I mean, you know, I love people who are smart because we think of such brilliant ideas. Like, wouldn't it be better to walk by a park than a dilapidated building? But that's what they did, and they showed.
Did you do any, you know, studies about that or detailed analysis?
So I think this is why the health argument is just so important, because a lot of the folks who are trying to act, even in the best interests of their communities, the health arguments are simply not on the table. And so if we had those arguments about how do we design communities to prevent violence, how do we design communities to promote walking around? I mean, I talked about if we solve climate change, we solve the health problems of our children. Obesity stands to shorten the lifespan of this generation of Americans. Think about that, folks. American life expectancy has been growing forever, more or less. So this generation of children may live fewer years than their parents, primarily because of obesity. Why are kids in the United States obese? Because of the food they eat and because of the exercise they don't get. So if we have communities where they cannot exercise, either because there's nowhere to exercise,
or they can't get good food, there's no supermarket, there's no fresh food.
And so...
And because they're stressed.
That's right, yes.
And their families are stressed,
Yes.
and they're trying to figure out how to get food on the table, and they can't get to a grocery store, but there's a McDonald's right down the block. And so these kinds of interventions are what I think mayors can get behind. These are the things, when they talk about, we're going to spend money to rebuild this road, we're going to spend money to rebuild this school, we're going to spend money to build infrastructure of any kind, that if we think about how that affects people living in those communities, we'll have an enormous win-win. And I just think that it's, you know, we see it already. I mean, people living in places that have changed, and Dick speaks to this so eloquently. If you've lived in these places, you see how they've changed in the communities, and you spoke to Fresno Central Valley, it's a profound effect. It lasts, people talk about it forever. They'll say, this used to be, no one went here. You remember this place? I grew up in Chicago. Downtown Chicago, when I was growing up, was a no-fly zone. I was told, you know, you can't go north of North Avenue, which is now very... There were the stockyards right next to our institute. It's now, does anyone know what's in the stockyards in Chicago? Well, my fellow Midwesterners ask, it's Millennium Park. So you've all seen the Bean. Mm-hmm. So no one went to downtown Chicago. Now you go to downtown Chicago and summer, there are families from all over the city meeting, talking to each other, and having a great time in a place which historically no one went to. No one went to. And that's what I talk about. So
this is what frustrates me. Oh, I'm sorry. I'm the moderator. I'll shut up. But no, I won't. This is what frustrates me, is that we're arguing about climate change and what we should do about it. We're acting as if we have no capacity to address it, when this is the future we should be running towards. Everything that you would want to make a city healthy and clean is exactly what you would want to bring to move to a low carbon future. That's what delivers it. And we like it.
We love it.
It's a future we can embrace. And it's actually a future that's economically more stable, where you have less national security problems, where you have job growth. Well,
and it benefits the people who need it most first.
That's
so
right.
We spend a lot of time, you know, be it in the buildings or in the communities, the people who are going to benefit most from these interventions are the people whose health status is most at risk today, which I think is one of the most important parts.
So if you're out there and listening or in the audience, you know, if your mayor is one of those that have signed up to really take action on climate, you know, ask him to look at their actions through a public health lens. Why wouldn't that be the way in which you make your judgment on what to do next? And you know, one of the things I've explained to people is that, you know, does everybody remember the Volkswagen diesel stuff that happened? Well, that was really a horrendous issue where there was lots of excess pollution, but the most fun thing that came out of that was so much money to invest in electric car infrastructure. Millions went to every state. Demand that mayors put that infrastructure in areas where the air quality is the worst. Demand that if you have electric buses, that they go to the communities that need the air pollution reductions first. Because why would you want to put those buses in a place where it's unnecessary or isn't more health beneficial? Let's build the constituency for this stuff. Let's not talk about climate as if it's somebody else's business or a problem that is too big for anybody to fix. The same with the healthcare issues and the trauma issues that we are seeing today in allergies and asthma. You know, this country wasn't built on defeatism. This country wasn't built on saying things are too big and we can't take them on. This country was built on us all working together, understanding our moral obligation. And it's not just a moral obligation to address climate change. It's a moral obligation for us to address the health of our communities, and a moral obligation to bring everybody up, not that just those who can most afford it. And that's what this panel has, I think, so eloquently articulated to everybody. And frankly, it's all about giving us hope that there are answers here, that with smart people like this who understand the health problems we're facing, they can help us design a future and solutions that are better for everybody. So I want to thank the panel, and I know you will too, for having a remarkable discussion, providing us with information, with baby information still power. Used to be in the 60s, it still is today. Let's use that science and information to help our kids and our future. Thanks very much, everybody. All right, we are going to take a little bit, a 15-minute break, and then we're going to come back with the next panel. So don't go anywhere, but go over there and have a cup of coffee or do whatever you like. Thanks so much, everybody.
So much fun.